Okay, guys, I think I'm on. Let's see. Telling followers. All right. I got one person. I know you. All right, gang. Hello, beautiful people. We are live. Instagram Live. P. Frank MD. And today's topic, non-invasive abdominal rejuvenation. It is a nice fall Sunday. I'm actually up in Pound Ridge, New York with my family. And a Happy New Year to those out there who are celebrating. I've been getting an enormous amount of Happy New Years to people, which I appreciate. I'm actually half Jewish. My father's of Jewish heritage. My mother is of Sicilian heritage. I'm what is known as a pizza bagel. So I kind of celebrate nothing and everything all at the same time, but I do wish everybody out there a happy and a healthy. I know people are celebrating tonight, and I'm right here with you. So today's topic is non-invasive abdominal rejuvenation. A lot of people are surprised that I do so many body things. As you know, one of my areas of expertise is in body modification, body sculpting, tumescent liposuction, and I do an enormous amount of things. Yes, pizza bagel. You like that? You never heard that before? Anyway, I do an enormous amount of skin things on the body. You know, it is the largest piece of real estate of every organ is the skin. So there's a lot of real estate off the neck, and the abdomen is one of the most common concerns, particularly since surgery is not always the right option. So as usual, I'm going to try and be organized about this. I'm going to give my spiel about abdominal rejuvenation. A lot of people typed in questions that they had for me on a prior story, and I'm going to answer those right here. And then I'm going to take some questions from the audience about non-invasive and invasive abdominal rejuvenation. So there are a lot of things we could do for the skin on the belly. I always look at things in terms of layers, right? You have the muscle tissue, you have the fat tissue, you have the deep dermis, superficial dermis, and the epidermis. So often there's a combination of several things that we have to address whenever we're doing any kind of rejuvenation. And the first and most important thing is, do I need surgery or not? And I'm the first person to say that if someone requires surgical intervention for abdominal improvement, then I certainly refer out. I'm not a plastic surgeon, I'm a dermatologic surgeon, and there's absolutely a time and a place for abdominoplasty or tummy tuck surgery. And usually the most common question I get, which is the first one up at the top, is how do I know if I need a tummy tuck, or if I need liposuction, or if I need just a skin issue? Well, a lot of the things we're going to be talking about today is really what I call skinny loose, right? Because there's an enormous amount of people, and a lot of my patients come in, they're thin, they're fit, the muscle is pretty tight, they maybe had a few babies or they lost a lot of weight over the years, and they're complaining about skin quality despite the fact that there's no hanging or pendulous skin. They're really concerned about the quality of skin there. And that's really where I perform a lot of my minimally or non-invasive procedures. Patients who have pendulous, hanging over skin and fat, that is usually something that really is a no-brainer, requires abdominoplasty surgery. There's no non-invasive or minimally invasive thing that's really going to take a belly that's stretched over the pubic area and make an improvement. Aside from the fact that in many of these cases, there are muscular issues as well. Women, particularly after pregnancy, or even people with significant weight loss, the muscle is stretched, a diastasis recti. So those are the patients that are really going to benefit from abdominoplasty surgery. But even after weight loss, even after abdominoplastic surgery, there are a lot of things that we can do non-invasively. People still have pigmentary issues on the belly. People still have stretch marks. People still complain of crepey skin, irregular skin around the belly button. And that's really where we can do an enormous amount of combination treatments. Now, even for people who only have mild stretching of the muscle, we have things like M-Sculpt technology. So it really is just not like when you go to a body surgeon and it's abdominoplasty or not. There's really a whole symphony of options that we have non-invasively. And as I always say, it's usually the combination of treatments that are going to give the overall best response. When you do this, earlier is always better. And you can do this in combination with things like abdominoplasty as well. A lot of people come to me for liposuction consults, tumescent liposuction consults, which as I always describe as underlocal, and they want to know, do I need a tummy tuck? Do I not? How much skin tightening can I get? You can get significant amounts of skin tightening with tumescent liposuction. Both the inherent aspect of removing the fat uses the body's own elasticity, but also we use several technologies. Vaser, body tight, we do get tightening. But once that skin is pendulous, again, that's mostly the cutoff of whether I send someone out for abdominoplasty surgery. And there are patients who are like, Doc, I understand your technique is really 24 to 48 hour recovery. Abdominoplasty is something I don't think I could handle either in cost or downtime or risk, or they just don't want that scar. And it is always the option. But what do I always say? It's about choosing the right candidate. I always have the conversation with somebody. Would you consider having abdominoplasty surgery? And if they do, I always say before we make a decision, let me refer you to experts in my circle, and we can make a concerted idea of what is going to be best for you. Liposuction certainly is a good start if there is fat there, but let's just talk briefly about the skin, because again, we're talking about that skinny loose phenomenon. Somebody who has just crepey skin, it has really been turned away by plastic surgeons for abdominoplasty. I did do a before and after with a green screen earlier on in the week. You can refer back to that on my IG and really see that before and after of that patient. Fit, thin, crepey skin, doesn't like their belly button, not a candidate for abdominoplasty. And again, we're looking at things in terms of the layer, targeting different layers. In this case, deep dermis, superficial dermis, epidermal skin tightening. And in that photograph, I used a combination of technologies, which is very, very popular in my practice. My nurse, Jen Kennedy, does quite a bit of this, and that is using Ultherapy for deeper tissue and energy-delivered microneedling for more superficial. I definitely find that these technologies have a synergistic effect, 1 + 1 = 3, and when performed together in one treatment, we could really make an enormous difference. And I suggest you go back to that before and after. I have some more on my website, and if you come in, I could show you a whole group of before and afters where we really see. I'm always impressed by the improvements that we can get in as little as one treatment by combining Ultherapy and energy-delivered microneedling. I use Vivace, I use Morpheus, which is always something people are asking about. Morpheus Body is a great technology which injects heat into the deeper tissue of skin, and we really get that layered effect. There's a little bit of downtime due to the Morpheus on the body, but really in about a week, we really see the tissue heal, and within 4 to 6 weeks, we see a dramatic difference. Usually the Ultherapy is the first and only treatment we need, and if someone needs subsequent treatments with Morpheus, we'll do that a month or two later. Again, we can layer this with other treatments. We could layer it with Fraxel treatments for epidermal changes. A lot of people have stretch marks after having babies. Even with a tummy tuck, you pull the skin down, and even if you give a new belly button, it does not get rid of the stretch marks 100%. People have pigmentation, redness, brownness from the trauma that they've had to their belly. And again, a lot of people that come to me, they've lost an enormous amount of weight. They're looking for the least invasive way to improve the skin. Again, there is a cutoff where they just require abdominoplasty, but we can do quite a bit with the pigmentation that's left amongst the stretch marks. These procedures have minimal to no downtime. Patients can exercise the next day. Obviously, you want to avoid sunshine afterwards. And I always say the earlier you deal with these issues, the better. I'm going to go to some of the questions that people have because it's going to answer a lot of the things in my spiel. Does liposuction tighten skin? As we discussed before, liposuction does tighten skin. It's not going to handle pendulous tissue. I use the Vaser internally, which is an ultrasound. I also use Body Tight, which is an internal radio frequency device that kind of irons the skin with heat from the inside and outside. So I'm really always surprised. I can show you a whole bunch of before and afters. We can get 3-dimensional tightening of the skin. But again, if it's hanging over, you really do require surgery. A lot of people have C-section scars that are too high. They have tummy tuck scars that are too high. V-beam therapy, microneedling, Fraxel, these are the mainstay treatments for these type of scars. How do I know if I need a tummy tuck? We discussed this. Oh, this is a good one. Bad lipo. can these non-invasive treatments fix it? Well, there definitely is a point where I will do revisional lipo. If there is really irregularity in the deeper pockets of fat, tumescent lipo is really excellent at treating this. A lot of people had this from, to answer another question, bad cool sculpting, people with lipohypertrophy and irregularity, or that kind of shark bite look that people get from cool sculpting. A lot of that does really require reintervention with tumescent liposuction, and that works great. But there are people with just irregularities of skin, and this usually has come from traditional liposuction performed by plastic surgeons under general anesthesia, where they're using 4 millimeters or higher cannulas. You're talking about cannulas thicker than the thumb, whereas in tumescent liposuction, we're really using instruments the size of a Q-tip. So you can, with over-aggressive liposuction, get irregularities in the skin. And I've seen remarkable results from the minimally invasive techniques. Microneedling works great. I will use biostimulatory fillers like Radius and Sculptra for those superficial fat irregularities that I'm cautious about intervening surgically. This is the thing. I always avoid surgery unless I have to do it, right? Because if you've had surgery before, there is scar tissue. You're reintroducing scar tissue after you have to break it up. So I will intervene with tumescent liposuction if I have to, but I always avoid it if I could. And this is always going to be a time and cost and risk-benefit ratio that has to be decided between the doctor and the patient. Revisional liposuctions are always harder to go in, particularly people that have had treatments like bad cool sculpting results. It always makes the surgery harder, but if we have to do it, we do it. I have great success with revisional liposuction. About 15% of my patients that I do tumescent liposuction on are revisional cases, and I would say about 30 to 40% of the patients I do liposuction on across the bend have had things like cool sculpting before, which can create certain issues during the procedure. So yes, people who've had liposuction before that left them with irregular skin, microneedling works great, biostimulatory fillers, fat transfer from other areas to fill microfat transferred into that area works really, really well. And again, we look at this as a layered approach. How many treatments? For most patients, 1 or 2 treatments with non-invasive abdominal rejuvenation really does work. You definitely should be seeing a significant difference with 1 treatment. And in terms of downtime, like I said, old therapy really adds no downtime. The microneedling and Fraxel aspect of it is really adds to downtime, and it could be 1 to 2 weeks. You do something, microneedling or Fraxel on their face, it's 4 to 5 days, or 2 to 5 days even. But the further you go away from the head and neck, the longer the healing, and that has to do with the vascularization and the healing of the body, less to do with the treatments. By the way, kids, have you noticed, if you joined my prior lives before, we're having pretty good reception. Thank you, Pound Ridge, Westchester. It's a little bit better than the Hamptons. So I did all the testing beforehand, so I hope to not jinx myself. We're getting good receptions. Wave or say something if we're not. So let's see here. Downtime, yeah. You have to give it 2 weeks when we're doing abdominal rejuvenation. If we're using V-beam for redness, that could be bruised for a week. Fraxel looks like a sunburn for a week. Microneedling could look poked at. And often, remember, I'm combining all these treatments together on the same time because the goal is to try and get a synergistic result, but also minimize the number of treatments because there obviously is a little bit of downtime, which is why a lot of people are doing this during the fall season. How long do you see results? It's going to take at least 4 to 6 weeks before you see results. Yes, Wi-Fi is so much better. Thank you for putting up with me. I am getting good at this again. How long do you see results? Again, it also takes longer on the body than on the face. You got to give it a good 4 to 6 weeks. Can you do liposuction and abdominal skin rejuvenation at the same time? That is a great question. I'm doing more of this. Like I said, I will often do intraoperative treatments with Vaser and Body Tight for internal and external tightening, but I am starting to do a lot of Morpheus body right after the liposuction, during the liposuction. Once I melt the fat, tighten from the inside, finish up, before I put the compression garment on, I will aggressively microneedle with Morpheus 8, and I am seeing differences, particularly around the crepiness of the belly button, right? Most people come to me and they complain, they stand up and they just want to they want to pull down the skin. I want to do that too sometimes. So yes, combining either during surgery or separately, it really doesn't add significant downtime for patients. I've had a tummy tuck with loose skin still in the upper belly. What to do? That is probably the most common area or thing three most common things people complain after tummy tucks are A, the scar. Get working on it at stitch removal, guys. Do not listen to plastic surgeons that say wait 6 months to a year. That is wrong. The data shows it. The earlier you get to it, the better. The surgeons I work with send them back to me at 4 to 6 weeks. You hit them with V-beam, you hit them with microneedling, you hit them with Fraxel aggressively, and that really can turn it into a thin white line. If you're left with too much of a white line, cosmetic tattooing is great. I will also use cosmetic tattooing, sometimes even for white old stretch marks. It is a great treatment after I've maximized technology. The other thing that people complain about is after they get a tummy tuck, they feel like their hips get bigger. Tumescent liposuction. I go in, it's an hour-long procedure. Patients are awake, 24-hour recovery. Again, you're pulling down the shades and they feel like they're getting weaned out. And I guess some surgeons don't feel comfortable doing or don't want to do full 360 lipo at the same time. I'm not really sure why. I'm not an abdominoplastic surgeon. And the other main complaint is still looseness up here, pulling down the skin. There are some surgeons that I work with. I know Dr. Ryan Neinstein, who's a great surgeon, does a reverse tummy tuck on some procedures by pulling up this way instead of this way. There are a lot of surgeons who don't believe in this technique. They don't think it comes out well. You do have to create scars underneath the breast. If you have had breast surgery, they try and hide it in there. A lot of surgeons don't feel comfortable with this. They say it's not a home run. I've worked with Dr. Neinstein before, and on the right candidate, it has dramatically helped. But again, a lot of people still complain of looseness up there. The Ultherapy microneedling Morpheus Vervace treatment really works spectacularly again. And again, the thinner, the better, guys. It works out great. Let's see. Can I do treatments when I have an umbilical hernia? A large percentage of people have umbilical hernias, and they are mild after having babies. They don't require fixing. There's a little protrusion. I generally, a contraindication to me for tumescent liposuction is unrepaired hernias, but a small abdominal umbilical hernia is really not a big deal. You certainly can do all the non-invasive treatments. There's no issue with that. I've even done things like M-Sculpt, which again, you have to be cautious about with any type of hernia, particularly abdominal hernias. But yes, with an umbilical hernia, you can do anything. Who does the best breast lift in your opinion? Yeah, you're gonna have to come see me. I do have some surgeons I work with. Dr. Maman, Dr. Neinstein, Dr. Kolker, Dr. Sultan. These are all amazing surgeons. Ultimately, they're all top tier. You got to find one that you feel comfortable with, and it depends on the type of procedure you're looking for. Umbilical hernias, yes, so you can do that. Stretch marks, we talked about stretch marks. Again, regardless of whether you have abdominoplasty or not, this is a big issue. Fraxel, microneedling, cosmetic tattooing, earlier the better, kids. If you got stretch marks after pregnancy, all these treatments after pregnancy, as soon as the obstetrician gives the okay for exercise, we start doing treatments, and usually that's about 6 weeks. So we do all these things. Dark line after pregnancy, this is a good question. The linea alba, people complaining about the dark line after pregnancy, which usually goes away on its own, guys, but sometimes it doesn't, particularly with darker skin types. We use ND YAGs or Pico laser for that, any type of pigmentation. We can use that laser. Again, if I don't see it go away after breastfeeding 3 to 6 months, we certainly treat that. Anything I can do after pregnancy, sorry, I wrote a little too small, I have to put on my glasses, guys. Anything I can do after pregnancy and when? Yes, okay, so let's go back to post-pregnancy mommy makeover stuff, right? You're not getting an abdominoplasty right away. You definitely want to give a year for the total skin contraction. But there are certain things that are going to happen. If you're seeing stretch marks, you want to get on top of them. If you had a C-section scar and you're seeing it thicken or get red, 6 weeks after pregnancy, you definitely want to get on top of that. If you have diastasis recti, where the muscle splits in the center, you definitely want to get on the M-sculpt. I mean, if it's very severe, you certainly want to seek plastic surgeon body sculpting, but most people have mild tears, mild separation. M-sculpt is an amazing treatment for a diastasis recti. I've seen amazing results. Again, as soon as the obstetrician gives approval for exercise again, getting on the M-sculpt for the body, for the abdomen, for the core. If women experience mild urinary incontinence, the Emsella chair, which is a type of M-sculpt device for bladder control and basically doing Kegel maneuvers. The M-sculpt Neo, the second generation, which we have a few of in the office, not only helps muscularly bring down the diastasis, but also has radiofrequency heat for the skin and the muscle on top of that. It's really a spectacular treatment that I recommend for all women after pregnancy to help cosmetically, to help medically, and even if you are a surgical candidate down the line, it is prophylactic and a great thing. I have a lot of women now have been using it for 4 years now, the M-sculpt technology. After the first treatment, they did it. First child, they did it, and then right after the second or third, boom, they're right on again. So yes, the sooner you do things after pregnancy, better. I'm sure that there are some instances where women have need significant abdominal repair or have issues where certainly you want clearance before you do anything. But stretch marks, muscle breakage. In terms of liposuction, tumescent liposuction, I do like to see women give themselves a good trial of getting their bodies back on their own. Again, I always say diet and exercise, there's never going to be a replacement for. My job is always made easier if you do the hard work first. I want to be the icing on the cake. I'm not the first 10 pounds, I'm the last 10 pounds. Do I recommend TrueSculpt? I do recommend TrueSculpt. That's my preferred non-invasive body tightening machine. I do have Cool Sculpting. I've always felt that very few candidates are good candidates for it. And again, in the negative input in the media, with what went on with Linda Evangelista and the totally underreported cases of paradoxical fat hyperplasia where it grows. I've known this for years, kids. I've been trying to deal with this because there are so many cases I have to fix. Anyway, the point being is Cool Sculpting I've always found has a very narrow therapeutic window. I do like TrueSculpt. It's very safe. It's a radio frequency device. You can play it on in many areas, and it's good for a small centimeter of fat. I do use it post-lipo. I do use it on people with, again, skinny fat. Instead of skinny loose, skinny fat. It works great. It does help with skin tightening a bit. And again, we could use that post-pregnancy. I do want patients to do the hard work first. When it comes to skin issues and muscle issues, I like to do it as soon as possible post-pregnancy. When it comes to fat issues and deeper abdominal repair, I say please give it 6 months to a year. You can do the skin treatments by, no one asked this question, but I'm asking it. You can do these things breastfeeding, right? I can't inject patients with Botox and fillers. I can't do biostimulatory treatments like Sculptra or Radius while someone's breastfeeding. We don't do drugs while you're breastfeeding. Although honestly, I think it's going to be quite safe. What would you use for dog ears after a tummy tuck? If it needs a skin excision, we do a skin excision. If it needs a little local liposuction, we do that. It takes a half hour under local anesthesia to do that. So I'm sorry to interrupt myself. Fat issues and surgical issues, I give 6 months to a year after giving birth to let a woman's body reset. Skin things like Fraxel, therapy, microneedling, we can do as soon as the OBGYN says it's okay. M-Sculpt, as soon as they do it, say it's okay, I do those things because it's not really a weight issue. And again, you want to let the skin, you want to get right on top of the skin treatments as much as possible. Everyone's Morpheus crazy, guys. Everyone keeps asking about Morpheus. Morpheus 8, it's advertised a lot. The Kardashians talk about it a lot. It is an energy-delivered microneedling machine. Is it good? It's good. I have 4 different ones. It's no better than Vivace. It's no better than Virtu. I have Infini. I have a lot of these devices that have varying versatility. I tend to use the Morpheus 8, which is a little bit less versatile. The options and setting changes are not as versatile as other machines like the Vervace. I tend to use it surgically. I do like the body hand piece on the Morpheus device, so I'll tend to use that surgically and on the body. But there are a lot of other upgrades and competitive devices coming out. Vervace is coming out with an amazing device that I'm super excited about in the next few weeks, hopefully, that I do work on and consult on with the company. So we'll have a lot of advancing technologies for the body. Elocore, oh my God, I forgot to add Elocore. I think that's how I'm going to finish it because I know a lot of people are celebrating. It's been 25 minutes. I'm not going to go on and on. Starting to use Elocore on the body, and that little skin and that little bit of skin on thin people around the belly button, whether it's from pregnancy, whether it's from weight loss, whether it's just from age, whether it's from, I bet you have all done this, right, guys? I have so many women that come to me and they just lean over. They're like, look, Dr. Frank, I'm fat. I have terrible skin. Please don't do this. Please don't do this. You're better than that, right? You know, we all do this. We bend over. They're like, look at my cellulite. I mean, you have to look at yourself with a human eye, people. And if you bend over and make weird positions, you're always going to be uncomfortable with yourself, okay? But a lot of people do bend over as they get older and they want to point out that skin around the belly button that's a little crepey or loose. I've done a few cases with Elocore already. I'm very excited about what we could potentially see with Elocore in that area. Again, for those of you who don't know, Elocore is a fractional microcoring device. It's a new technology that I'm involved in the development of, where we can, under local anesthesia, with minimal downtime, extract and cut out little pieces of excess skin without scars. Those little holes get extracted. It looks like a sewing machine. They close up without scars. And yes, there are some healing issues that we have to consider when we are doing it on the body, right? Because healing is different. It could be longer, maybe potentially higher risk of scarring. So, but the Elocore on the body, I've done it around the belly. I've done it on the décolletage. I've done it on the arm. I'm doing in numerous cases here. I can't wait to do my own treatment. And that's it, guys. I don't know, unless I see you've been all very good. You haven't been throwing me unnecessary questions talking about the face when we're talking about the body. I appreciate you all being here. I hope you're having a good weekend. I know whether you're Jewish or not, a lot of people do have off tomorrow. I will be working tomorrow in case you need me. If there are any final questions, I'll take a look here. Let's see. I don't really see it. Maybe I'm just not that popular tonight. That's also a significant. Dog ears we talked about. And I think that's it. Oh, wait, hold on a second. Hold on. Can you do M-Sculpt after mini BBL or does it damage the fat? You can use M-Sculpt in a non-fat destructive way. That's a great question. I'm so glad I scrolled back. There are settings on the M-Sculpt Neo that does not use the radio frequency, so it will not affect the fat like on the buttock if you do have a BBL or fat transfer anywhere. You just don't want to get rid of the fat because there are some people that are very, very thin on the belly, and actually getting rid of fat will make the skin crepier. So yes, you can do M-Sculpt with a specific setting. There's a lot of different settings with M-Sculpt Neo. It takes a trained professional to guide you through it, but the answer to that is yes. Well, you can do it. Let's go through any other questions. Do I recommend True Sculpt? Yes, we talked about that. We're talking about face. I think that's it, guys. Anyway, it's been 28 minutes. I'm kind of hungry. It's for an early dinner. Do I like the Morpheus? We got all that. Anyway, thank you for joining. I'm going to go enjoy the rest of the day. I wish everybody celebrating a happy holiday, and I will be there tomorrow, right there at P. Frank MD. Peace out. See you later, guys.